Sometimes you're cruising along with your pizza because you want to get home before it gets really cold. I don't blame you. But it just so happens that you go a little too far, and let's say you start to strain your hamstring muscles for whatever reason. And there's a few, we'll explain. There's a few. For whatever reason, your hamstring gets pulled on a bit too hard. It gets really yanked on, and it goes into something we call a spasm. And really, a spasm, in a simplistic way, is a muscle contraction without need. It's trying to pull into a shortened position now. It wants to contract the hamstring in this case. You could do it with different muscles, but the hamstring in this case wants to pull into that flexion at the knee, extension at the hip. But there's no reason for it, none that you can see. Anyways, now part of this is a communication error. It's believed. The jury is still very much out on this one. It was thought to be dehydration and electrolyte balance some time ago, but it's not totally disproven, but it's not the complete reason. So neurologically, we can look at a few different things. The muscle itself will have neurology, will have nerves going to and from. Let's take a look at the afferent side first. There's sensory nerves, all kinds of stretch and length receptors, and there's of course, to an extent, there's vibration and pressure receptors and all that. And that'll be from the muscle itself. But as well, the fascia, the connective tissue running over all of these things, the muscle, and down right into the joints, and that is very important, right into the hip joint and the knee joint, and we'll be talking about in this case, also has some kind of sensory perception, going back to the spinal cord and to at least that, L2 lower, higher region, give or take. And we've got sensation from the joints themselves. Remember, those joints, they actually do have nerves, and those nerves often mirror the fascia and the muscle within that region. They're all tracing back to that spinal cord. Some of it will be motor, some of it will be sensory, but they're going to be heading back towards usually a gamma motor neuron. That's going to be your big one. If we're looking at the short cord reflexes, if you will, the things that decide how things are timed, how things are brought on and off locally. Of course, there's higher level control, but the gamma motor neuron, quite locally, will control some of this. And when we get a confusing signal, way too much of a particular signal, what it can do is send a big efferent, confusing reflex, if you will, down. It'll go through the alpha motor neuron, and it'll go to that muscle, and it will be telling it, hey, something's wrong. You need to contract. Now, a lot of it's going to be coming from some kind of confusion related to some of the muscle spindle receptors. Let's say we got a bunch of these guys hanging out in here. That's not to proportion, but they are concerned with length. And if they believe, for whatever reason, due to a miscalibration in the system, or at least a confusing disagreement between all these parts, they will say, we need to be short, and the gamma motor neuron will be aware of this, or it will be the one saying, hey, you're too long, and it will control this reflex. So it is, in some ways, it's believed to be a communication error. Now, there is, unfortunately, a natural reflex, and we all have probably done this at one point or not. We want to stretch it out. That's our first instinct, but it is a very wrong instinct, in fact, and it's dangerous because it can lead to a tear. It can lead to tearing of the muscle, so we definitely don't want to stretch it out. If the muscle, again, hamstring, give or take, right about there, if the muscle is trying to pull us back to a certain position, and we instead go the other way. We try to lengthen it. We even pull on it with our arms. We yank it that way in a resistance. It may let go. You may just be able to pull it hard enough that it lets go. But the problem with that is it can potentially damage the muscle. It may cause it to actually tear some of the fibers, and that's really dangerous. Counterproductive, really, to what you're going for in this case. The better alternative is actually to shorten the muscle. Let me get that on screen. Shorten the muscle. That's what you really want to do. And we do this by bringing the attachment points closer together. So you do have to know a bit of the direction of the muscle. So if it's on the back, really to make this real simple, if it's on the back, bring the parts of the back closer together. In this case, we go a little further, but in this case, a really simple way of doing that is bringing the knee up into flexion. And then we could also make sure we don't want to bring the hip this way. That would be the opposite. We want to bring the hip into what we call extension back this way. Both of these positional changes shorten that muscle just a bit. Whatever we can do to shorten that muscle, it's a good thing. We actually take it the way it wants to go. It's trying to actually do something. It's not, it's not a stupid quote unquote system. It kind of knows what it wants. So if you bring it into a shorter position, typically this causes a resetting. Now, ideally, what we can also do at the same time is, where possible, longitudinally compress along the length of the muscle. This usually requires the third person or you to have some interesting mechanics, but if you can at the same time flex the knee, extend the hip, and press along the longitudinal, the length of the muscle, if you just push it up, cinch it all up, you often get a significant reaction from all that together. It's very effective in fact. What it will do, because again those muscle spindles, do them in purple here again, because those muscle spindles all throughout that muscle are perceptive of length, and because the receptors in the joints and the fascia as well are perceptive of length and strain and position, and all of that, every single part of that is calibrated into that system about how short or long the muscle should be, by taking off the pressure, by taking off the irritating mechanisms as well, by taking off any irritating strain, and by shortening that muscle nice and smoothly, we can get what's called a gamma motor neuron resetting. So it will reestablish what is the actual length, or what the length should be, and it will tell that muscle spindle fiber, or it'll tell that muscle, hey, you don't need to keep contracting here. This is much better than pulling really, really hard on it, because when we pull really hard on it, you may not actually stop it from firing. You may not stop that muscle from pulling really, really hard. That's why it's so dangerous. It might just keep coming back. Whereas in this case, once we've taken care of that, once we've stopped all this from happening, let me get rid of that. Once we've made it so that it's not contracting anymore, we can very slowly, very gently start to bring that leg down safely. Do it too fast, and you will reverse everything you did, but we bring it back to a normal position, and usually it is fine, provided you've taken care of the problem. Just as another example, though, just so it's nice and clear, the abs are another good one, and it's a good way of explaining how this works. We follow the tissue, or we read the line of contraction, if you will. Really, you want to read the anatomy at any given time. So when we get a bit of a side cramp, again, maybe you're running, suddenly, shockingly, you had to get a cramp in your side, and hey, you're healthy, what's going on? You used to run when you were 18. It's only been 20 years, what's the big deal? Anyways, okay, so what you want to do, you see the ab muscles generally have a vertical orientation, largely top to bottom. Great. But they can also have a little bit of a sideways orientation. That's the external obliques drawn here. We also have the internal obliques, which go a little bit more like that. Largely, though, it's a vertical orientation. So if you just split the difference, it's kind of there. So what you want to do to shorten those muscles, again, go with the direction they are cramping into or shortening into. We want to take the rib cage and bring it closer to the pelvis. We want to bring the two attachment points closer together. When we've done that, we've shortened things up. At the same time, now, you won't necessarily know exactly which muscle it is, but let's say it's the external obliques. If I bring myself into a rotation here, we're also shortening this way as well. We're shortening it up on the more oblique axis too. It's a little more specific. Now, if that doesn't work, all you have to do is just rotate the opposite way, in fact. Very, very simple. And when that's the case, you should feel the muscle reduce in contraction. You wait a little bit, and then gradually reposition to normal. Ultimately, this is an effective way of calming the body down in general. And incidentally, it's a manual application. You may know this as some of the indirect methods if you're in the manual therapy world. commonly counter strain or strain counter strain, but many other indirect, gentle methods work based on the exact same methods or principles.